My name is Dr. Aamer Khan, and I'm the co-founder and the Chief Medical Officer for the Harley Street Skin Clinic in London. We've just developed a new facelift protocol. It's a non-surgical facelift, and it really came about through experience. We had been doing Botox fillers and suture lifts as well as skincare for our patients for a long time. And what we found was, because aging has different components, what we wanted to do was target each of those components specific to that patient. So we developed what we now call the Khan Facelift, which combines the treatment. So it's part of the Khan combined treatment. And we've developed it, we've tried it, and our patients are really happy with it, getting great results. So we've decided to launch a training program as well, an advanced training for people who are already experienced in doing botulinum toxins, fillers, sutures and skincare with peels, so we can help them to combine it and to offer that to their patients as well. One of the benefits of a combination treatment is that we address multiple factors. So for the patients, they may come in complaining of a jowling, but what we find is that they don't just have jowling, they've got volume loss, they've got skin aging. If we combine treatments to address each of those factors, they're going to get a much better effect and outcome. Also, it's going to be more cost effective for them because we're combining it, doing it in one go, and they're not coming back and saying, okay, that's great, but I'm now concerned about this. So we use it as a holistic approach. The other advantage is that it allows us to plan ahead, because aesthetic treatments aren't one-off. And what we find is that aesthetic treatments are a journey, because aging is continuous and it's persistent. So we plan for a year ahead. So we can make that plan and also explain that our plans are going to change from year to year as they age. We use a hyaluronic acid filler. Personally, I like Stylage because it's a very good filler to use. I like the feel of it, it molds beautifully, and it's got mannitol in, which is an antioxidant, and we get secondary effects on the skin. We get skin improvement over a month to 6 weeks. So I like using it. The other thing I like about it is that they're always on top of things. They've just introduced a new BiSoft technology, which allows us to use one hand to inject and to aspirate as well. So that just makes it easier. When we're treating patients, there's more and more technology coming out, and I find that you've got automatic syringes, you've got machines that deliver the actual product. In my experience, I've always used a syringe because I get a better feel for it. And I use a bimanual approach. I like to feel the skin where it's going in. I like to see the rays as a filler goes in. And with experience and doing lots and lots of treatments, you get really used to using that, and you can visualize what's happening at the different levels of the skin. With regards to the fillers, I think fillers are fillers. The basic technology is there, and different companies bring out slight variations in them. Select a filler. I like this one particularly. I like Stylage. Select it, use it, get used to it, and do lots and lots of treatments. And what I tend not to do is jump from one technology to another simply because somebody's brought another one out, because that puts me right back to that starting phase again, where I've got to get used to it, find out what the problems are, what the benefits are. I like my product, and I'll carry on using it until they bring something out that's significantly different. With regards to techniques and protocols, it's really important to learn the techniques from somebody who is experienced and who's got lots and lots of patient experience behind them. Once you learn that, then you can start applying it for yourselves, and also have that link, because everybody, once they start doing things enough, they're going to run into situations. They might be good, they might be bad, but feeding back and sharing information is really useful. I always say that anybody who hasn't had a problem with filler or who hasn't had a problem with any of their techniques are either not doing enough or they're lying. So be open about it, share the information, and let's just improve the quality of the service that we're delivering.